I'm so glad that you are here. We've got such a wonderful time to share this great news. Brian is here with Dr. Laura. Hey, Brian, thank you so much for joining with us.
Thank you for having me.
Yeah, so Brian has a very interesting story. He has been in pain. How long? 30-something years, Brian?
35 years.
What happened to you, bro?
I had a 20-inch box fan fall from about 15, 20 feet up and landed on top of my head.
A box fan fell on his head. You're not a very lucky guy. I'm just saying. A box fan fell from 25 feet right on his head. He was young, 20-something years, just out of college, right?
Right. Yep.
But you didn't sense the problem immediately, right? I mean, except for your head was split open, right?
Right. Other than that and possible concussion, it was probably 6 months. And then I started having migraines, which I never had before in my life. So, and never had any back problems before either. So.
And, that's a very good point. I think that a lot of people who have migraines likely have had some type of injury that they maybe took for granted. They forgot about it because the initial issue is they thought was over, but it's probably just a residual from an injury. Who knows? So you were having migraines, and then what happened?
I started first, I think, by going to a chiropractor and, trying that. And, I'd feel better for a while, but then it didn't continue. So because it was an injury that happened at work, I ended up with, going to doctors and, they had sent me to an orthopedic doctor and, did x-rays and actually was told at one point, I should feel better any day now. And that was, like I said, 34, 35 years ago. So,
but it was clearly you had nerve damage. So when you fell, it compressed your nerves, all the way down to the tip, whatever, your sternum, whatever, right?
Yeah. I mean, later on I saw, basically I had compression in all the way up and down my spine, from tailbone all the way up to my neck. So
then they went in and did some slicing and dicing. They took out some of those little, what do you call them? What did they take out?
Yeah, years later, it was 17 years ago, I went in and had a fusion done. So I had a lumbar fusion about 17 years ago where they took out 2 discs in my lower back. And so then that was better for a while. And then
so for those of you who don't know, because if you haven't dealt with this, you may not know, but in between the two, all the lumbars, you have a little cushy pillow, right, Dr. Laura? And it's supposed to cushion between the bone. And so they literally, those were so done, they just took them out. They were so damaged, they took them out and they basically glued your lumbar together, right? Is that right?
Yeah, they put in a metal cage basically around your.
Oh, I didn't know that's what they do.
Yeah. And
I bet it's fun to go to the airport.
Yeah, I have a little card that I get to carry with me all the time now.
Oh, okay. Yay. Oh boy. So then you said something that you had one up at the top too. So 2 at the bottom, 1 at the top. So you're like
taken out.
Frankenstein now.
Yeah, I have a few scars.
Yeah, but as far as like, you don't probably feel the cushy that you used to feel. Maybe you don't have the pain, but you don't have the maybe as limber as you used to be.
Yeah, you lose that flexibility, so yeah. Turning, rotating, things like that is where you notice it.
Right. So then, but the pain came back.
Yeah, the pain, I went through over the years, going through different things where the pain got a little better and then I'd think I was headed in the right direction, but then it would get worse again. And so that led to other procedures over the years, trying to do things. The last 5 years, I've gone through radiofrequency ablation on both my neck and lower back, where they go in and burn through the nerves in those areas that send that pain signal to your brain, trying to eliminate that pain signal. But it's one of those things that, they're using an educated guess where to burn through. So sometimes it works, sometimes it doesn't. And I've had pretty good luck with it helping at least some until this last year in both my neck and my back. It didn't help at all.
Okay, I just got to say, none of that sounds good. Burning through your spinal cord does not sound like something I'm at all interested in doing. So then but then you heard, I think on Mike, you don't really know exactly how you heard. You've seen Freedom Force Battalion, you've seen Mike Adams. Dr. Laura was on Mike Adams one time. So then you found out about this. Said, let's give this a try. So enter Dr. Laura, the one who is always making people better. And it's so fun. It's just so fun to be around her and see all the people getting better. So tell us what you take it from there, Dr. Laura.
Well, Melissa, I'm just so happy to see Brian feeling a lot better. And so basically we start seeing him in February, we have the telemedicine with him because he wasn't close to us, to our state. He decided to come after he had a consultation, and we realized that we were a good fit and that this could work for him. And so he has been coming to Houston for around 4 times, I think. Once, and he stays for a week, and we do treatment with neural therapy. What we have been doing basically is what actually I think they were trying to do with the radio frequency ablation, which is to stop the signal of pain. But in the way we do it is actually we're sending a message through the nerves. So we're healing that nervous system, that area, and we are reteaching the nervous system into stopping the signal of pain without causing further damage.
Right.
So
instead of burning it and killing it, we're actually restoring it, reviving it so that it will stop sending this terrible pain signal.
Absolutely. So it's been so nice, you know, just to see his progress and to see him. He was, well, in tremendous pain. He's, you know, he's a father. He works all day long. He works on his computer, so he has to sit all the time. I know many people can relate to that, and actually the back fusions are so common nowadays, and there is so much residual pain from it that you know, so many people could benefit from it. But anyway, so with Brian, we started, and he immediately started seeing some significant relief from the back pain, from the migraines he was having, and from other pains that were showing up around different surgeries and different trauma. Because what we don't realize, as you were saying at the beginning, many things that happen over the years, and we said like, oh, well, that happened to me 20 years ago.
That's over.
Yeah, that in many cases, our body is just storing that information, that cellular memory, and at some point in our life, it starts showing up. So all the information for us is really important. And going through his medical history, we found out what we needed to do, and we're working with him, and he's doing a lot better. I would love. So he actually created a
yeah,
chart.
I'm going to show that. Yeah. So you were on, like, did you say how many pills a day? 8?
Pain pills a day, yeah.
8?
Yes.
And now you're already down to how many?
4.
That's amazing. That's amazing. And so I think he's a brainiac, because I'm going to show you guys what in her Dr. Laura's brochure, where she shows that this is typical, that you'll see the pain step down. You know, it depends on each case, but that it steps down little by little to retrain the nerves so they stop sending signals when they don't need to. And so I think that's so cool, because that's what Brian created. Tell us about this, Brian.
I spent all my working days working in spreadsheets and stuff. So
okay.
When I started this, I thought, well, I'm going to track, you know, kind of where I'm at. For so many years, I've been asked, you know, hey, what's your pain level? What between 0 and 10, you know? So I'm used to doing that. So I started tracking kind of where my highs were and where my lows were. And as Dr. Laura said, you know, I spend probably 10 hours a day work-wise sitting in front of a computer. So I'm not moving a whole lot. I have times where I'm not moving for several hours at a time because I'm on calls. So the red marks at the top are basically my high numbers, and then the blues are my low numbers. And I'm tracking it each day. But the one thing that you can see on the red marks, there's a dotted line that kind of goes down through the middle.
Yes.
So that's a trend line. So it's showing that I'm trending down as far as where my top pain levels are.
That's amazing.
Yeah. And then the bottom one hasn't changed much. It's changed just a little bit, but it's coming down. So it shows me heading, you know, in definitely the right direction.
Right. You certainly don't have whatever number this is, that pain level of a 10 or whatever. You aren't having any more of those.
No.
That's
No.
so wonderful. And that's what's
And
enabled you to be able to get off of so much of the pain medication, which has so many other side effects, you know, and they were going to put you on more. Really, that's all they say is we're going to, let's see, destroy your nerves and destroy your kidneys. And so, yeah, so you are on the right track. You're on, you know, the move, just like my mom, to get your, you know, your life back basically and be completely pain-free and completely, I pray in Jesus' name that you will. And also, you know, drug-free. You know, because this is what happened with my mom. You know, she doesn't even take aspirin. It's really amazing. And what's so I'll go ahead and stop sharing the screen. But what's so wonderful is that this is not anything terribly invasive, you guys. This is little tiny injections of lidocaine, like you get at the dentist, and you just it's really, I think, almost miraculous how it has such a restorative effect on the nerves and just heals that myelin sheath and causes the signals to be reset where they'll work properly. Am I saying it right, Dr. Laura?
I'm impressed. You're saying it perfectly. So yes, that's what it happens. And it is beautiful how, well, you know, with a medication that we all know is so safe, but also that we think it's just a numbing agent, there are many studies that have shown that it also has a lot of other properties, and that's what we're looking for restoration of the nervous system.
Yes, that's so wonderful. Well, we're going to jet out of here, but I just want to share that with you guys. I'm so thankful that you came on to share your story, because there are so many people who are in the same boat and need to know. They just saw this week about about my good friend Dana, who had whiplash, and she's doing so much better after that. Someone with Bell's palsy. I've had people with Lyme disease. Well, I've had people with, I have, you have. I've interviewed people that Dr. Laura has been able to help, who've had been able to throw away their canes, throw away their walkers. I mean, it's just like Jesus time. So let's pray together and let's just give thanks. Thank you.